Hello,
Mhm.
everyone. It's Dr. Umar again from Hive Medical Academy's podcast. Thank you very much for joining us once again. Today, we've got Dr. Saif, who is currently a GP ST2, so he's a GP trainee. He's a UK graduate, and he's very kindly agreed. It's actually midweek, so it's very good of him to join us in what's probably a busy week for him, to just share his thoughts on UK careers, international medical graduates, his own kind of journey to medicine, and his own aspirations for the future. So hopefully it will be an interesting discussion. Welcome, Seth. Thank you for joining us.
Thank you. Thank you. Nice to be here.
Um, Thank you. So Seth, could you share with us a little bit about your journey to medicine? Because I know it was a bit longer than the usual route. And
Yeah,
just
definitely.
about the journey and what kind of motivated you to actually
Mm,
to take that difficult route.
yeah. So, as Dr. Omar says, I didn't go the traditional route. I, after college, I applied for pharmacy and clinical sciences. I kind of always wanted to do something science-based. I quite enjoyed like medicine in general as like a concept of doing that as a career.
Mm.
But unfortunately, from college, my grades weren't good enough to apply. So I decided to try to apply for pharmacy. At that time, I was working in a pharmacy as well, and clinical sciences as like a backup option. So I ended up going into clinical sciences for my first degree, and I did. I completed the full degree, and then in my final year there, I was thinking about what I wanted to do going forward. And there's a lot of discussion about people doing postgraduate medicine, postgraduate anything else, basically.
Mm.
Um, so I thought, okay, this is a good chance. Why don't I try and give it a go? So I sat the UK car. I decided that I'm going to try and give it a go this one time. If I make it, then fair
Yeah,
enough. So yeah, luckily I did really well in the UK cat.
excellent.
Did quite well in my degree as well. Managed to get some offers around the country, and eventually settled on going to Newcastle. So I ended up doing the 4 year course there, the graduate program. So I actually
Okay.
ended up doing a total of 8 years of university. So it's a lot longer than what people normally
Yeah.
do, but
Yeah.
it was definitely a good journey.
Excellent. That's really nice to hear. My because not everyone, kind of falls into it like
Mm.
immediately, and things don't necessarily always pan out the way we want to. But it's really nice to hear that um, that you actually kind of stuck with it, and obviously now you're doing very well.
The thing is, it's
Um,
never too late as well. There were
yeah.
people on my course in
Okay.
Newcastle who had done completely different careers. There were some people who literally were in their
Yeah.
40s,
In
even
the
later than that.
postgrad course.
Yeah, to go to the postgrad. So
Wow.
they basically there was like a police officer. There were people who'd gone to other careers,
Wow. Wow.
done that, and then thought I want a change in career. So it's
Yeah.
it's never too late, and it's always don't think any people that are listening and think
Mm.
at the stage that I haven't got in from college that it's over. There's
Yeah.
always different
Yeah.
different stages. It's never too late to go into it.
Yeah. That's really good. That's really good bit of advice. I was going to ask you, if there's any advice you'd give to anyone, but obviously you've done it. You've done it there yourself. So that's really nice. Um, did you consider going abroad at all? Was that ever on the radar? Like, because lots of people do it nowadays.
Mm. Yeah, yeah. So essentially, the course that I did at Bradford, clinical sciences,
Yeah.
um, the first year you can transfer into a medical school if you get certain criteria.
Okay.
So basically, a lot of people that were on that course were wanting to do medicine as a career.
Mm.
So I didn't know of that as an option until I
Okay.
joined the course, and I had some friends who were thinking of it. So I did look into it,
Mm.
and the thing that kind of put me off a little bit was the uncertainty because I think, correct me if I'm wrong, it's usually 5 years, maybe even 6 years that you have to go abroad. Um,
Mm. Yeah.
and the
That's right.
uncertainty of are things going to change in terms of
Mm.
government policy, being
Mm.
able to come back and
Yeah.
work,
Yeah.
whether you'll be at a disadvantage. At the same time, as well, it is cheaper from a tuition point of view, but you're not able to get support like you can do here with the
Yeah.
student finances. So that kind of um, that kind of stopped that in its tracks. But I think if I didn't get into the graduate entry, maybe that's something I would have considered. Because I know a lot of people who have done it and successfully have come back and they've got good careers now as well.
Yeah. Yeah, that's right. So it depends a lot on where you go as well, because obviously there's some people who go to places which are in the European Economic Area
Yeah,
and some places that are outside it, and whether you will have to do PLAB or not, depends on where you go. But obviously that was just I was just wondering if it had crossed your mind.
yeah.
Um, did so I can't remember now when you went to medical school, but was there because everything now if you watch the news as a layperson,
Mm,
over the last couple of years, maybe even few years since COVID, there's been a lot of negativity about the medical profession, careers, job opportunities, these
mm,
greedy doctors, striking again, all that kind of stuff. So at the time when you did medicine, when you were looking into doing medicine,
mm.
did it feel like that was around at all then or not? Or has it changed, do you think?
Um, a little bit, but I do think it's changed a lot since COVID. Um, there was a little bit of that, that medicine's not as good as it used to be kind of feeling. Because I actually started in 2016 medical school. So I think,
Okay.
if memory serves me correctly, I think the common thing is that the NHS was at its peak around 2008.
Mm, yeah.
So maybe like about 8 years after that. And then
Mm,
it started to slowly decline, but it still seemed okay. And then I think from graduating, I actually graduated in 2020 when COVID started. So I
okay.
think going into the career, I went in um, when COVID was basically at its peak, and it had just started. So I think um, it was that's the point where things changed a lot. But for me,
Mm,
that's all I knew from like a starting, from a career point of view. That's I didn't experience it working wise before COVID, um, but I definitely think that was the turn, a
yeah.
big turn because I think it set things back a lot compared to how it would have been if things just continued. It would have been a slower maybe
Yeah.
decline, but that made it a bit more rapid.
Yeah. And do you know, I mean, obviously you're a fair bit younger than me.
Mm.
Maybe people, kind of come to you for advice or, ask you parents or family friends or even, you know, other people who are, who see all of this or they're interested in medicine for
Mm.
themselves or their children.
Yeah.
Do they ask you like, is it still worth it? What would you say? And what do you say to them? Because obviously you've been in
It-
it for a few years now.
mm.
I'm now out of it for a few
Mm.
years. So how do them conversations go?
So it's really difficult. You know, I feel like currently at the moment, the overall morale of like doctors and medicine in general is quite low
Mm.
in itself. Like,
Yeah.
so it's difficult to kind of, you know, if someone's asking you for genuine advice to tell them that
Mm.
yes, it's a great career, everything's great, there's no issues, you'll um, really enjoy it, you'll have, you know, lots of job satisfaction and things like that. But I think the reality on the ground is very different because of the low morale at the moment. So when someone asks me for advice, the main thing I say is, yeah, go for it if you'd like, but
Mm.
you really need to be motivated
Yeah.
and be driven to think that this is really what I want to do. Don't think you're getting into it just because, I'll get into medicine, I'll do a few years
Mm.
hard work, and then I'm set for life. And it's not really, it
Mm.
doesn't seem to be that kind of career anymore. Um, it's still
Okay.
good. It's still, um, a good vocation to have. But I think when I give honest advice to people, I say really think about it
Mm.
rather than just,
Yeah.
yes, it's good, go for it. You like science, you good at it, go for it. So I
Yeah.
think it's just it's difficult. I don't want to put any people off, but I
Yeah.
also don't want to
Yeah.
give someone advice where they come back to
Yeah.
me and say,
Yeah.
"What was that?"
Yeah. Yeah. I understand. And I understand it is a difficult situation. Um, But I think that, to be honest, if I think about it, that doesn't seem too different to maybe how I would have felt 10 years ago.
Mm.
Or maybe at any stage in my career, because there were always the good things, and there were always the difficulties, whether it was stress or whether it was burnout, whether it was, tough hours or, doing exams into your 30s or whatever it was. There
Yeah.
was always something to say to people, oh, but do be aware of this.
Mm.
Um, so, obviously that there's some extra things now that, which we'll discuss in, a bit later on about opportunities, job
I
opportunities,
think
and
that's the biggest
yeah,
thing at the moment is
yeah,
you used to, if you got into medicine and became a
yeah.
doctor, you thought, you know what, okay,
You kind of
at least
knew.
I've got a job for life, I'm sort of set.
Yeah,
Whereas that doesn't really seem to be the case anymore, surprisingly.
yeah, yeah. So, although, I mean, it still opens the same doors for you that it did 10 years ago, 20 years ago, 30 years ago, which is, working anywhere in the world,
Yeah.
and having the opportunity to be able to do that, which not all degrees or careers kind of grant you. So there are still lots of positives,
Yeah. Yeah.
I would think, but I don't want to kind of change what you're saying too much. Um, so tell us a little bit about how you ended up in the GP training program. What kind of went through your mind? What were
Mm.
you thinking during medical school, afterwards, your foundation years?
Mm.
Did they put you off something, or did they, how
Yeah.
were they, and how did it affect your career choice?
So I think I always quite enjoyed problem solving, diagnostics,
Okay.
that kind of thing. And so when I started working, or even during medical school, doing general practice, I saw patients come in, undifferentiated patients come in with a presenting complaint, and your job is in 10, 15 minutes, figure out what's going on, make, appropriate investigations, management plan. And that's like, that's you done. And then the next person comes in, which could be completely different. And I quite enjoyed that kind of process. So when I started my foundation years, you have your general surgery job, your medicine job, things like that. You, I didn't think the sort of day-to-day ward life was what I wanted from a career. Um, I I quite like finding out what's sort of wrong with someone and then managing it as well. And obviously,
Mm.
you do that in GP with like chronic
Yeah.
cases and things like that as well. But I just didn't really enjoy that ward aspect. And when I did my GP
Mm.
rotation in F2, I did really enjoy it. And I thought, okay, this is something I can see myself doing.
Yeah.
It also, the main thing people say as well, is true. It's the work-life balance. It's the fact that you don't have to, um, you know, cancel a week of your life because you're on nights,
Yeah.
or you're
Yeah.
doing
Yeah.
a long weekend shift or something like that. You can
Yeah.
actually plan your life a little bit better. So that was a big
Yeah.
reason,
Yeah.
as well, to be honest.
Okay. Well, because I was just about to say, why not A&E? When you said that, the
I,
undifferentiated bit, and
I,
then but again you kind of you preempted my question and
yeah,
gave the answer.
I really enjoyed it, A&E, to be
Yeah.
honest. I did really enjoy that
Yeah.
rotation, and I did it as
Yeah.
well, part of my GP block, and that's it was really fun.
Yeah.
But I
It's
think
good.
that was the main thing that kind of swayed me
Yeah.
was the work life balance.
Yeah, but it's like sometimes when you go on holiday, isn't it? When you go to a place, you think, oh, I really enjoyed this for like, yeah, 1 or 2 weeks, or as the case may be, for 4 months or 6 months. But you
Mm.
think, will I actually live here? Do I want to do
Yeah,
this for like the
exactly,
rest of my life? And
exactly.
then you think, no.
Yeah.
So, yeah, makes sense. And did your career choice kind of evolve a lot through medical school, through foundation year, or was it something, did general practice, was that something you always had in your mind, and kind of your experiences just solidified it?
So I think through medical school, I was quite uncertain, and I also kept an open mind because I heard
Yeah.
from people just don't make a decision right now, try and experience a bit of
Yeah.
everything, and then figure it out. And sort of after my foundation years, I've found myself leaning towards GP, but at that time I wasn't 100% sure. So I ended up doing a couple of F3, F4 years, just locum
Mm.
years.
Okay.
And then I think at that point I thought, okay, I don't feel like anything else is really dragging me in
Mm.
as much as GP is. So then I
Yeah.
decided to go down that pathway.
All right. Okay. Well, I'm very glad because general practice needs high quality, compassionate individuals like yourself. So I'm glad you chose general practice. It is, it is still the best option, I think. Obviously, we're biased having done it, and but I do try and encourage people
Yeah.
to
I
go
think
into
it's
into
quite
general
underrated. I
practice.
think as well as a
Definitely.
you know there is this kind of uh, maybe in the medical field a little bit of a concept that the GPs they're
Yeah. Yeah.
um, not as good as the specialists or the consultants. But
Yeah.
if you think about it, as a GP, you could be seeing a baby for a baby check, then have to see an 80-year-old with back pain, and then see a
Exactly.
40-year-old who's having heavy menstrual
Yeah.
bleeding, all within the space of 30, 40 minutes.
Yeah.
And you have to know how to investigate, manage. Whereas being a specialist is great, but if you ask a
Yeah.
cardiologist to look at someone with a broken hip, they might not know, or like a hip pain, they might not know
Exactly.
what to do.
Yeah.
So I think it's quite underrated, and it's quite a good choice of career.
Yeah. Definitely. The generalism, I think, is a high skill in itself, and that's obviously what general practice is about. Um, so how do you, what are your thoughts kind of for your future career? Obviously, you're in ST2 now, so
Mm.
you've got to do this year, and then you've got to do ST3.
Yeah.
Um, because I know obviously there's been, again over the years, locum jobs have become really difficult to come by. And
Yeah.
then recently, over the last couple of years, some of the people who I knew, who I met with, and they said, even GP trainees who were their GP trainees were struggling to get jobs, like any jobs.
Mm.
So bearing all that in mind, the current context and everything, and what are your thoughts on what you're going to do immediately after you qualify and maybe further into the future as well?
So I did hear that same sentiment of people being able to find jobs like once they finish GP training. More so maybe like a year or two ago, I think
Yeah,
I'm hearing from people and seeing on online forums and blogs and stuff that it's getting a bit better on the ground.
that's good. That's good to
Um,
hear.
so I've not got any immediate plans, but I think I would
Yeah.
like to just it'd be great to get like a salary job for if
Sure.
possible, maybe do some extra work on the side in
Mm,
kind of um, a local capacity or even in like an urgent care. It kind of
hmm.
mixes a little bit of
Okay.
that. It keeps a little bit of my interest in A&E and
Yeah.
acute stuff, but also keeps that GP balance as
Yeah.
well. So maybe something like that, and then further down the line, more options are open in terms of would I go down maybe like a partnership route or think of maybe going abroad and things like that. So
Mm,
I think I'm really trying to keep it open in terms of what I'm actually
yeah.
going to do going forward.
Okay. Yeah. That's yeah, a good idea. Obviously, keeping things open, seeing how things feel. I think one of the things I did was, and lots of people do, which is again the one of the biggest advantages of general practice is you can build your own career. You can build a
Mm,
portfolio career where you know, can go into all sorts of stuff. So obviously I went down the teaching route,
yeah,
did some clinical leadership, some medical political work as well. And then, so you can just kind of, the clinical side can become part of your week, and then the rest of the time you can do something else, which is always a good way to just fight off that burnout.
yeah,
Because
yeah,
cold face stuff in the NHS, especially in general practices, if you're doing like 7, 8 clinical sessions a week, it can be really
can be a
really
lot.
tough. So your thoughts on going abroad? You mentioned it briefly yourself, but is it something you're seriously considering, or you're just thinking, oh, it's like it would be a nice to do thing?
I think it's probably the second one. I think
Yeah.
you know you hear stories or you speak to people who've done it, um, and a lot can change in 2 3 years once
Yeah,
I've actually qualified. So I think it's something that I'd like to qualify and then work for a little bit, build up my experience, and then
yeah.
if them opportunities are still there,
Mm.
you know, if it's the right time and place, and I think it's the right thing for me, it might be a case of going abroad maybe for a few years and then experiencing that as well. It's good, I think, to get experience in different cultures and countries and things as well.
Yeah, definitely. And yeah, I know quite a lot of people, as I'm sure you do as well, who've either gone or they're still there, and you only hear good things. Obviously, the grass is never, it's always greener on the other side.
Yeah,
But it's good
exactly.
for a short period of time or a few years maybe.
Mm,
Um, just for something different because I think as medics, I don't know if you can if you relate to this, but it's kind of we're we're so risk averse,
hmm.
like in general. I mean, that's all our training is about, isn't it? It's about looking out for danger and red flags and be
Yeah.
cautious and do this and I think that becomes part of our personality. Honestly, I really do. Like since after finishing clinical practice, I've only started to realize how kind of you can just get into a place where you just feel comfortable
Mm,
and you just do that for years and years without ever kind of going outside your comfort zone or especially if you dabble in entrepreneurship, you'll see how uncomfortable it really feels because we're so we I mean this is a generalism obviously, lots of people are different, but
yeah.
but doing something that actually feels scary or feels like it's uncomfortable, I think it's a good thing because you'll always learn from it, you'll always develop and you'll always obviously grow as well. And
Yeah.
and the good thing about being obviously from the UK like yourself is you can always come back if it doesn't
Mm.
if it doesn't go well or if it was only a short thing. And you always learn stuff wherever you
That's
work and
that's
wherever
the
you
big
go.
thing. Yeah.
Um,
It's about like I said, learning, getting different experiences, trying to put yourself outside your comfort zone. Um, all lived experiences, aren't they? It's a way to develop and become better as a person.
yeah, definitely.
Mm.
So, we mentioned a little bit earlier about kind of, specialty training, and hearing lots of, kind of negativity and there's always most weeks there's something about doctors, junior doctors, or there's not enough jobs, or there's not enough specialty training posts, and whatever it may be. And now obviously there's this added thing of IMGs as well, who we deal with, on a daily basis, international medical graduates, people who have graduated outside the UK and um, they want to try and make a better life in the UK as our parents and grandparents did at one point.
Yeah.
Um, and so what's your I mean, obviously you're in a training program yourself, which is good. You're going to finish that, and then it looks like things are settling down in general practice.
Mhm.
Do you have friends or colleagues who you actually know yourself who are struggling to get jobs or to get into training? And how are they? What are they doing?
Yeah. So I've got a few friends. So like I mentioned, coming back to university, I did the 4 year course. So I had friends who graduated a bit later than me on the 5 year course, and people who did intercalation and stuff. So I know quite a few people who maybe in the last couple of years. So I think luckily I got into training at a time where it was still okay, and I think
Okay.
it was seen as you probably will get a place. The competition ratios went
Right.
too extreme. I
Mm.
think they've become a lot more challenging now, especially when I think of the MSRA and GP training and things like
Yeah.
that. I have
Yeah.
friends who I was just speaking to him actually a few days ago, who ended his F2 in August
Hmm.
and sat the MSRA. I think this past sitting in January or February, but he's not met the cutoff, and so he's not going to be able to uh, get into any sort of training program. And he's actually as well struggling to find locum work at the same time
Mm.
because the place where he did F1, F2, which is where I did it as well, um, it's not readily available. So you
Okay.
used to be able to get um, a Monday to Friday, or like you used to be able to get 4 or 5 shifts a week where you could sustain
Right.
yourself a little bit. Now it's quite difficult, maybe even to get 2 or 3 in certain circumstances. And so I know he's struggling quite a lot, and he's actually
Mm.
considering um, going across the world to Australia, New Zealand,
Australia, New
see what
Zealand. Yeah.
opportunities that are going
Yeah.
on there.
Yeah. Okay. Yeah. I mean, it's yeah, because kind of being detached a little bit from the clinical practice side of things, it's sometimes obviously I read recently GMC's workforce report, and obviously there's this emergency bill as well,
Yeah.
which is in I think it's in the House of Lords at the moment.
Mm.
And that's going to get passed, about favoring UK graduates,
Yeah.
which affects a lot of the people we deal with on a daily basis, or at least psychologically affects them, even if necessarily, practically it doesn't do yet. Um,
Mhm.
so what do you have any experience of working with international medical graduates in any of your specialties or any, hospitals where you worked,
Yeah.
A&E maybe, or and what is your experience of them and how did you see them?
Yeah. So I've worked with quite a few throughout F1, F2, locoming, and even in my GP training as well. So first of all, I'd say they are very, very knowledgeable. They know a lot in terms of medicine, kind of really well. Their book knowledge is amazing and great.
Mm.
Um, I think the ones that I've worked with, especially in A&E, have been great. They've been there for a number of years, clinical fellows, and
Yeah,
they are sort of very like senior in A&E.
yeah,
Um, I think the parts where I see them struggle is when they initially come in, and I don't think that's to do with their knowledge or anything like that.
yeah,
It's more to do with the processes.
yeah,
Um, so I think that's the main kind of struggle, regardless of where they come from. If they come from, um, you know, America, Asia, Europe, they all kind of struggle with the same thing, which is
yeah,
the processes. And I think that's just kind of getting used to the
yeah,
NHS as a system, really. But they've all been, like I said, from a clinical point of view, they've all been really good
mm,
that I've worked with.
yeah. Yeah, usually I don't know which type of course you did at Newcastle, but when our degree was at the beginning or kind of like the early days of problem-based learning,
Yeah,
um, where you kind of it felt like we used to laugh about it a lot though. It's like DIY medicine, where we barely had any lectures.
yeah,
And a lot of it was just like we would be in small groups and we'd for like two-week periods, and we'd cover like the gastrointestinal system in that 2-week period, and we have to like study it all ourselves, and there'd be like one or two support lectures. This is like 20 years ago. um
yeah,
so coming across people who come from like the old style courses, which is what how things used to be here, like 40 years ago, where they do solid 2-3 years preclinical, and then they do the clinical work. Like they don't see a patient until like third year or something.
yeah,
As yours, I'm guessing was probably quite similar in that it was an integrated course, because they have been for a long time now. That we started patient contact maybe even in year one, if not in year two. And
yeah,
so coming across people who are really book knowledgeable is quite intimidating initially, because you have a bit of an I used to have a bit of an inferiority complex. I used to think that, these guys they know way more than me, in
yeah,
terms of like
definitely.
the
So even
basic
with
science and stuff.
we're starting like GP training. Obviously, you have your
Yeah.
Thursday teachings and stuff, and they'll ask you sort of questions in terms of just like management or investigations, or
Yeah.
how would you deal with this sort of patient. And yeah, it can. You sometimes come out and you think, wow, I've got a lot of catching up to do.
Yeah.
The knowledge is really on point.
Yeah, but obviously, the flip side is that of that is, our degrees were obviously, our communication skills were like developed from an early part of medical school, and
Mm.
consultation skills um, and ethics and things like that. And obviously we're not to give the wrong impression. We did obviously learn everything we needed
Yeah,
to
yeah,
complete the medical degree, but it just feels like sometimes these guys yeah, they know a lot more because here they got rid of some of the stuff that they felt was just superfluous. It was just unnecessary. Like you didn't need to know about the Krebs cycle as a doctor. I mean, what was there's no point in learning it, so they got rid of all that kind of stuff.
I remember. I'm not sure
Um,
what university it was, but I remember like that can go too far as well because I'm not sure
yeah,
what university it was, but
okay,
I remember hearing that some universities weren't teaching anatomy or testing anatomy as a basic subject because they thought, okay, it's not
really?
super important
Wow.
compared to
Okay.
physiology. But I think that, like you said, there's certain things that you have to do as a doctor,
Yeah,
like
yeah, of course,
the
yeah.
bread and butter things, and you have to learn the basic sciences. But
Yeah.
yeah, I think we're all at a good level, but then sometimes people are at a bit more of a higher level.
Yeah, that's right. Yeah. But like you said, it's the processes, sometimes the communication that they struggle with because obviously
Mm,
English isn't their first language.
yeah,
But it takes some time to kind of get as it would if we went the other way, if we went to wherever they come from.
100%.
It'd be exactly the same. Okay, so um final thought from yourself on or maybe just like you building on what you said earlier, and you can tailor this to either people here, students who or young people who are interested in doing medicine, or even maybe IMGs abroad who they face a lot of negativity at the moment. Over the
Yeah,
last
yeah.
year, 18 months or so, there's so much negativity out there on the internet on, oh, you'll pass your PLAB, then you'll never get a job, or maybe even for people who are considering medicine now that, it's not what it used to be and but the thing is, we never really go into medicine, at least I think most people don't ever go into medicine thinking because it's going to be it's going to be like among the best paid or because we all knew that there's so many other careers that you could have gone into if you're just thinking about finances. So is there any advice that you'd give to maybe people in the UK and also IMGs
Mm.
about your experience here, obviously doing medicine, working in the NHS, trying to maybe putting some positivity on what was a mixed discussion.
Yeah, no, it's difficult to think of trying to encapsulate it all into
Yeah,
a few statements, but I think I think my advice to so younger people here first,
yeah,
my advice would be, like I said, make sure you definitely want to do something like that. Try as best as you can to speak to as many people as you can, and try to get some form of experience where you see what the day-to-day job is, or to see exactly what it is that you're hoping to go into, hoping to get from it. I think that's the really important part. Um,
okay,
and then for, I guess, doctors from abroad, I would say, in terms of the process of coming here, it is a very good job. The NHS is quite supportive. Um, the overall morale at the moment is quite low with doctors, but I think that's on the up. Hopefully, I think we've
yeah,
kind of maybe reached
yeah,
the
the
trough, and
bottom.
like kind of slowly coming back up a little bit.
Yeah,
Um, so I think that would kind of be my general kind
okay,
of advice, that if you do want to come over, um, then it's difficult to try and get experience beforehand, but um, you know through companies and things like yourself who are able to
yeah,
help them, I think it's beneficial for them.
okay, that's great. Thank you very much, Seth. Thanks for joining us and for sharing some personal thoughts and experiences. And maybe maybe in the future, when you're further along in your career, we can get you back on and see how you're doing. So thank you very much for your
Yeah,
time. I really
sounds
appreciate
good.
it.
No worries. Thank you very much.
Take care. Yeah.
Bye.